everyone! First of all, let me introduce myself. My name is Christin Riana Dewi. People usually call me Christin. I am a student at Stikas Eka Harap Campus. I am currently pursuing a bachelor's nursing degree. In this video, I will explain about hypertension or high blood pressure. Over a billion people around the world have hypertension or high blood pressure. Hypertension is a term used to describe high blood pressure. What blood pressure is a measurement of the pulse of the blood as it pumps through your arteries. Let's start by defining it. Typically, it's represented by two numbers. The top number is the systolic blood pressure, which is the arterial pressure when the heart's contracting. And the lower number is the diastolic blood pressure, which is the arterial pressure when the heart's relaxing or repelling most of the time. Blood pressure is taken in the brachial artery in your upper arm. Because of the pressure's high there, it's probably high throughout all of the arteries. Normal systolic blood pressure is defined as less than 120 millimeters of mercury, and normal diastolic pressure is less than 80 millimeters of mercury. Elevated systolic blood pressure is considered between 120 and 129 millimeters of mercury and less than 80 millimeters of mercury in the diastolic side. Stage 1 hypertension is between 130 and 139 millimeters of mercury on the systolic side, and between 80 and 89 millimeters of mercury on the diastolic side. Stage 2 hypertension is defined as anything that's 140 millimeters of mercury or higher on the systolic side, and 90 millimeters of mercury or higher on the diastolic side. While there are many cases of hypertension, some of the greatest cases will be family history of high blood pressure, condition of the kidney, condition of the blood vessels, and of the nervous system. Increased cholesterol also contributes to hypertension, and of course age. As we age, our blood vessels become stiff and that increases our blood pressure. The water and salt ratio in our body contributes to high blood pressure, and also certain hormone levels would also contribute to high blood pressure. The symptoms of a high blood pressure are sometimes very vague. It could be something just as simple as headache, also confusion, any visual disturbances. Sometimes nausea and vomiting could also be a sign of high blood pressure and nosebleeds. However, it's important to note that hypertension is called the silent killer, because you may be walking around with a very high blood pressure and have absolutely no symptoms at all. That's why it is wise to have your blood pressure checked frequently, because although you may be feeling perfectly fine, you could have high blood pressure. Treatment of hypertension involves lifestyle modification or in combination with antihypertensive medication therapy. World Health Organization recommends preventing and controlling blood pressure by reducing and managing stress, a healthy diet consisting of lots of fresh fruit and vegetables that provide nutrients such as potassium and fiber, limiting sodium intake, being aware that many processed foods are high in salt, sugar, coffee, and liquor. In addition, avoid foods with high sodium levels, limit your intake of foods high in saturated fat, maintain ideal body weight, do physical activity, avoid smoking, avoid alcohol use, and regularly check blood pressure. Foods that are easily found in everyday life to reduce hypertension: watermelon, kiwi, banana, quaci, olive oil, oatmeal, garlic, celery, green vegetables, temulawak, and ginger. So, the only way to know if you have high blood pressure is to have your blood pressure taken. Thank you, and I hope you found it useful.